There is your question. Right. So if you have read and understood, considering its surgical anatomy station, kindly please tell me what area or what region are you looking at?
I'm looking at the gluteal region.
Yes. Of human specimen, yes. All right, good. Can you tell me how would you identify the muscles of the gluteal region?
The muscles of the gluteal region are divided into two compartments, superficial and the deep.
Very good. Yes. Can you please, yes, identify this muscle with the arrow?
Gluteus maximus.
Can you please tell me the origin, insertion, and nerve supply of this muscle, please?
Gluteus maximus arises from three regions: posterior to the posterior gluteal line of the ilium bone, then from the coccyx and the sacrum, and third from the sacrotuberous ligament. The insertion of the gluteus maximus is over the iliotibial tract and the gluteal tuberosity of the femur bone. The nerve supply of the gluteus maximus is from the inferior gluteal nerve, which is L5, S1, and S2.
Okay, can you in this image identify, please, gluteus medius?
Gluteus medius is over the just above the gluteus maximus. The fibers arising from the iliac crest.
Okay. If we come on the right-hand side, would you be able to identify this structure?
This is right gluteus minimus.
Okay. And right, if you can identify what is this hiatus or this opening, or
this is greater sciatic foramen of the right hip bone.
What passes through it?
Three structures pass through is piriformis, obturator internus, and nerve to obturator internus.
Okay. Can you
and
sciatic nerve, of course. Can you please identify gluteus minimus out of these muscles, either side, whichever side you can identify?
Gluteus minimus muscle is visible over the right side, most laterally arising from the ilium bone.
Okay. What is Trendelenburg syndrome, or how would you identify if a person is suffering from
Trendelenburg syndrome? There is an injury to the superior gluteal nerve, resulting in the drooping of the sound side of the pelvis. When we make the patient to stand over the affected limb, the normal side will sag, and to compensate for that, the affected limb will lurch and tilt the pelvis.
Okay, if a person gets injury of the gluteus medius muscle, how would it affect or what is the role of gluteus medius muscle in walking of a person?
Gluteus medius is the medial rotator and abductor of the hip muscle. So when this muscle is affected, medial rotation and abduction is not possible, resulting in the Trendelenburg sign, which will cause lurching of the affected side.
Very good. Okay, we are moving on. Can you identify the bones you are looking at on the screen?
I'm looking at the femur bone of the left side.
Yes. Okay, can you
In
please identify, or can you please tell me how the hip joint is formed?
hip joint is found by the articulation between the head of the femur with the acetabulum labrum of the pelvis bone.
Okay, can you tell me if you can identify what is number, where is my question? 3 over here.
Head of femur.
Okay, 6 please.
Neck.
4.
It is intertrochanteric line.
What attaches here, please? Okay, we can come back to this later. If you can identify number 5.
This is the lesser trochanter.
Please tell me the attachment. What attaches here?
I will come back to this
Yes, later.
question
Okay.
later.
What is 11 on the right hand side in picture C, if you can tell me, please?
This is the neck. No, this is not. This is the trochanteric fossa.
Yes.
This is the trochanteric fossa of the femur seen from the upper aspect.
Okay, right. If you can tell me, what are you looking at right now?
I'm looking at the femoral arteriogram of the
Yes.
left side.
Yes. So this is number
With,
1. Can you tell me the indications? When would you ask for this imaging?
whenever there is absent distal pulses, or there is ischemia or acute limb, or when also in cases of trauma, when we don't find the distal pulses, or there's a laceration to the femoral region, to look for the patency of the supply.
Good. Can you identify quickly all the numbered structures?
Number 1 is a cannulated structure.
2.
In the abdominal aorta. 2 is the common femoral artery, and then it gets divided into, then it gives branches 3 and 4, which are lateral. 3 is the lateral femoral circumflex nerve artery, and 4 is the medial circumflex femoral artery. It further branches into 7 and 6. 7 being the medial form the superficial femoral artery, and 6 being the lateral will be profunda femoris artery, and 5 arising from the 6 as the perforating branch of the femoral artery.
Okay. Can you please tell me, right, how, if a person gets injury of the sciatic nerve, how would the patient present? What would be the clinical features, or what? How would the patient present?
Sciatic nerve injury will cause the absent sensations over the lateral aspect of the thigh, and also till the hallux of the great toe.
What about the motor loss? What about the motor loss of the sciatic nerve?
Sciatic nerve supplies the anterior compartment of the thigh. So the muscles forming the anterior compartment of the thigh, like iliopsoas, quadriceps femoris, they will be paralyzed, and also the sciatic nerve give branches to the hamstring muscles.
Okay, what when it comes to formation or arising of the sciatic nerve, there is certain variations. Can you tell me with reference to sciatic nerve?
Yes.
Piriformis, sometimes, yes.
Sciatic nerve arises from the lumbosacral plexus, and then after it enters the gluteal region, just below the from the gluteal region, and passes through the greater sciatic foramen. Then it has certain variation while passing along the piriformis muscle. Sometimes the sciatic nerve can divide into two parts, which is tibial and the common peroneal nerve, by passing below the piriformis. Sometimes the division can occur within the piriformis muscle, and there are times when the division can occur above the piriformis muscle.
Okay, good. Right. Thank you. Right. Thank you. The list gone. Okay, before, yes, if you can, please, before we end, can you please tell me what are you looking at? What kind of imaging is this?
I'm looking at the posterior aspect of the leg muscles with the marked structures at the most proximal end being the popliteal artery. Then it gets divided into a tibioperoneal trunk.
Yes.
The most lateral artery is the anterior tibial artery, and the middle artery is the peroneal artery, and the most medial being the posterior tibial artery.
So this is the lower limb angiogram. What are the indications? When would you ask for this investigation?
Whenever there is an injury to the popliteal fossa, or whenever there is a suspicion of trauma leading to the absent distant pulses, or there is a cold ischemic limb, or in peripheral arterial claudication.
So if you can tell me what are the three branches that you're looking at, what is this one? Main?
This is popliteal artery.
Yes, very good. So if this is popliteal artery, which one is this?
Posterior tibial artery.
Very good, excellent, very good. All right, now we can maybe end. Good, thank you.